Hi, I'm Ovik Roy with Roy Healthcare Research, and I'm here with Lars Marcher of Ambu, a Danish company. Lars, maybe you could tell us a little bit about your three main lines of business.
Yeah, we are focusing on the healthcare space, been that for 75 years. The three segments or business divisions are mainly in the anesthesia market, servicing the operating room and intensive care units in the hospitals. Then we have what we call a patient monitoring and diagnostic business, where we are the market leader in cardiology and neurology products. And lastly, we have emergency division that are focusing on training and simulation of mannequins and neck collars for emergency services.
And how do the revenues for your company and also the earnings split out between those three businesses?
We don't announce what the earnings split is between the three, but if you look at the revenue, it's roughly about 35% in the anesthesia, but growing rapidly at the moment. About 50% in the PMD market and the rest in the emergency care.
So the anesthesia market is where most of the growth is. Would you say that's also where the highest margins are as well, or are the margins comparable in each of the businesses?
Overall, the margin in the anesthesia segments are higher because you also invest a lot in new innovations and stuff like that. So you have to maintain high profit rates. But also in the PMD, especially in the neurology business, we have the leading products in terms of the needles that are all manufactured in Asia and very high margin products.
And you sell these products throughout the world, or do you have partners in some territories?
For 75 years we have been developing our direct sales organization. So in US, in all countries in Europe, and latest in China and India and Malaysia, Australia, we have our direct sales organization. We believe that's the way you can serve our hospitals the best way. And we have about 26,000 hospitals globally that we serve on a daily basis, and that's very important to us.
And is that where most of your growth is coming from emerging markets, or do you see some growth in the Western countries?
We see, of course, Europe at the moment being quite troublesome. Not Europe as a whole, but we see, of course, Europe and Southern Europe, like Spain, Italy, being hurt at the moment. US, we see a nice growth. We're growing with double digit in the US marketplace. And obviously in Asia, we see 30% plus at the moment, but from a lower base, of course. But that means that every 3 or 4 years, we double our business in Asia at the moment.
So is it a little bit like, it's a little bit like the pharmaceutical business. For a while, maybe 10 years ago, people didn't really talk about emerging markets that much, but now emerging markets is 25% of global pharmaceutical revenues. I mean, in your businesses or in anesthesia, say, what would you say the market is? What percentage of overall global revenues outside of Ambu specifically are from those countries, those high growth Asian countries?
Well, if you take our business in particular, we have about 38% of our business in US, which for a European company is quite large. About 55% in Europe and the rest in Asia. So we believe that in the next 5-6 years that there will be a massive improvement of single-use medical devices for the Asian market, due to the fact that the level of hospitals are really increasing. I mean, they're building really a significant amount of hospitals both in India and China, and the population demand better service than in the past. So the health and the wealth of the population is going to be very, very important for us.
Do health reform efforts in various countries have a big effect on how you think about the growth outlook for various countries for your businesses?
Well, in Europe, as you know, it's very different from US. I mean, we have a public healthcare system that is very much funded by the taxpayer, and everybody has the right to go to hospitals without caring about the financial income. In US, obviously, we see the health reform in US whenever it's going to be implemented as a good thing for Ambu, because we depend on operations. So the more people, obviously, that get the ability and opportunity to get operating in hospitals is good for our products.
Has there been a growth in the U.S. in the number of surgical procedures or anesthesia requiring procedures? What's the growth rate of procedures, volume growth?
I mean, the growth rates come from several indicators. One, of course, is that you get more kind of cosmetic operations, new lifestyle operations. People are getting fatter, basically, that require a lot
like
of new
liposuctions and gastric bypasses, things like that.
But also people are living longer, so hip operations and knee operations, elbow operations are significantly increasing, and on top of that you have a population that are growing dramatically in the next 25 years with more than 2 billion people. So we are definitely in the sweet spot in terms of the number of operations, but we're also in the sweet spot because we believe that disposable medtech products are going to be the future for cross-termination issues, for cost issues in the hospitals, and for availability purposes, that if you have a single-use product, it's already and always at your hand.
Give us a concrete example of a disposable product that you try to sell into the market where people might now use a reusable product. The clinical advantages, the cost advantages, how would that work in a real-world setting?
A good example is the latest product we just introduced into US. It's the first disposable fiber optic scope that you use for a difficult airway. So the current products in the marketplace are very expensive products from Olympus and Pentax, very complicated camera technology, very costly, up to about $60,000. The maintenance of those pieces of equipment are pretty high.
Sterile and all that stuff.
And every time you have to use it, you actually have to sterilize it, and you bring it down to the basement of the hospitals in big washing machines with a lot of chemicals and stuff like that. So by bringing in a $200 disposable product that you use one time and have the same functionality, and then basically get rid of it after the operation, optimize the workflow, and they reduce the cost significantly in hospitals.
In the U.S., what would you say is the penetration of your products versus the reusable, versus reusable products?
If you take one of our core areas, which are really the airway, difficult airways, where we provide laryngeal masks and stuff like that, we're probably sitting with about 40% market share in the US and probably 60% in Europe.
So there's still considerable opportunity to increase penetration.
Still to take market share away from our competitors, still to grow faster than the market grows, and then of course to add on blockbuster products that can convert the business from, for example, multiple use of heavy equipment to single use light equipment.
We talked about how the growth dynamics of your anesthesia business is driven a lot by growth in the emerging markets and steady growth in the U.S. with a bit of a lag in Europe. Is that true in the other two lines of business? Are the dynamics
it's very much the same trend. I mean, if you take the cardiology business, where we are a world leader in terms of providing electrodes for ECG procedures and stuff like that. We actually bought a company last week that will further consolidate the electro business. So today there would probably be three companies in the world dominated. That will be 3M, Covidien, and Ambu. So the requirement for electrodes going forward will grow significantly. The requirement for high quality electrodes are even more important now, because if you want to make diagnostic service of patients, if you don't get the right signal from the electrodes, you can't actually come up with the right solution for the patient.
How much, in terms of how we think about this dynamic in the growth, because there is always going to be need to increase penetration of more disposable products, increase penetration of healthcare generally, particularly, and again in places like China and India, and then you have the Europe as a laggard. I mean, are the problems in the Eurozone material to your business because you're so diversified? What's the impact of what's going on in the periphery of the Eurozone for your business?
I mean, fortunately, because we're in the single-use market, we don't see the same kind of roadblocks.
No capital expenditures.
Exactly. So in Europe, you could say that the hospitals are so-called radioactive towards capital investment. However, from a consumable point of view, operation has to happen. So where we see the kind of issues at the moment in Europe is in Spain, in Italy, but the issue is a temporary one for us because they just reduce the inventory right now, and they can only do that to a certain level before they have to rebuy. So we are not that concerned about the number of products being used in Europe. They'll continue to be high, but of course, as CEO, you have to be concerned about what happened if Greece or Spain or whatever collapse. Obviously, that could send quite a lot of bad influences and signals to the rest of the economy.
What percentage of your revenues come from those pigs, so-called pigs countries specifically?
We talk about between 8 and 10% that are coming from those
relatively contained.
Yeah.
And are you finding the problems? I know that it's true with pharmaceuticals, where, for example, in Greece, hospitals aren't reimbursing pharmaceutical companies for shipments. Are you finding problems of that nature?
No, I mean we've been fortunate so far that we're in some kind of another category, and the price pressure and stuff like that we haven't seen that, because you could say our products are really in the life-threatening arena. So there's a good balance between seller and buyer here, because if we pull out of hospitals in Spain, for example, people die because we are so dominating with our products.
And so how about emergency care? What are the dynamics there that are different from the other two businesses?
Well, the emergency care business for us has been a historic place to be in. I mean, we were coming out with some of the first mannequin for training purposes, big rescue services, Red Cross, to make sure that they actually were simulating the best possible way to basically do heart massage and stuff like that. So today we see this market more like a niche market to us. We don't see the growth in that market being significant, and over time we might see that market either being divested or consolidated one way or the other.
Lars, you've been in a lot of different businesses. You've worked at IT companies, you've worked in aerospace. What would you say what are your takeaways from your experience in the healthcare world as opposed to these other businesses? What are the challenges? What are the opportunities? What are your reflections on that?
Well, the big reflection is that if you don't have a solid platform in terms of your infrastructure in the company, your manufacturing system, your supply chain, the IT that connect the different global regions you're in, you can't scale the company. So what I have been able to take into Ambu has been my experience in scaling company, for example in the IT or other businesses, where it's so important because of the competition that you are super sharp on supply chain and manufacturing, stuff like that. So over the last 2.5 years, we have moved our manufacturing to Asia. We now have about 800 or 900 people in China with our own manufacturing site. We have the same size in Malaysia, and it's all Ambu manufactured product, and that's key. So I believe that the medtech business as such, that you can drive faster and therefore get more competitive edges, also by bringing new innovation to the market as soon as you possibly can.
Great. That's great. Thanks, Lars, for joining us, and best of luck to you.
Thank you.